missing sirindenyon Gilbert Koriren logoiwek choton ak en logoiwek choton chekiwongunen ko Fistula ko miondo ne en kasarta nekoi ko kikokochi kipkerermet kwonyik kosubkei ak netomo konyorchigei ichek en oindo kole niton ko miondo netinye konyoiset en kasarta nekaibwat ngwony komugul akobo kit let miondab Fistula ko en nganasetab Eldoret kobun kibagengeit nebo Let's End Fistula Initiative ko kikotoret kwonyik chechang missing en kokwatinwek chemiten ngwony sobet konyorchigei konyoik koboto kanaptaetab sobet anan economic empowerment. Ngenyorun logoiwek choton en koindo kobun sirindenyon Cherotich Korir.
En kasarta nekoi kotomo konyorchigei biik naet akobo miondab Fistula. Ole eng changindo biik kokere kokonu tewernatet eng kwenutab biik. Kobate eng betutab rani lekaibwat emet komugul akobo miondab Fistula komite walutiet anan konyoiset noton nebo miondab Fistula. Kosubkei ak Sarah Omega ne ine ko Executive Director nebo Let's End Fistula Initiative Levi, kora ko kikosobe ine Fistula ko kiib ine kakwautik nebo kocheng ak komut kwonyik alak chebune kaimutik cheu choto konyorchigei konyoiset.
And so that is basically how Levi started as my personal mission to share the good message, the good news that treatment was possible. That fistula, when you're living with fistula, you didn't do anything wrong. It wasn't your mistake. You're not being punished for something that you actually didn't do. It is just a childbirth injury that requires, a surgical intervention. That is when now Lefi was now formally birthed when I finally got support from then a non-profit from the United States called One by One that came in now, helped me now to set up Levi formally. Mm-hmm. Yes, and we are doing why it was important for us now to find these women and link them with fistula treatment opportunities, because most women that we found around that time, they were telling us they didn't know what it was. They didn't know that it was something that required, medical intervention. They didn't know that this is something they would actually go to the hospital and, ask for help. They thought maybe, like one of the women told me, she was told that those are signs of HIV. Mm. Yeah, and in some communities, they believe that maybe only toka nje ya ndoa and now you're being punished. Yeah, and some they just didn't know. Maybe especially for first-time mothers, they thought maybe that is what that is what happens to women after delivering. Mm-hmm. So that's why there was need for us to go out there, reach out to these women, tell them no, there's help. You can be treated. You can go back and resume your prior lives.
Kates komwa ine kole eng kasarta nekikosobe ichek Fistula kotoreti kokanapta sobenywa eng oretab economic empowerment.
So they support each other, and kando na hiyo, maybe those few cases ambazo zinahitaji specialized counseling, we come in as Let's End Fistula Initiative to support that. But again, I think once we feel like they're finding themselves, now we come and we introduce the aspect of economic empowerment. Because as I shared earlier that women living with fistula, they can't be employed. They're unable to maybe go to the farm. They're unable to run business. Kumaanisha kwamba wengi ni maskini. And it drains them. They're drained economically. And therefore, if we are actually giving them back their lives, we need also to address the economic aspect. So we come in, one, we provide mentorship. We do capacity building for these women in a group setup, whereby we teach them about financial literacy. We teach them how to, come up with a business concept, idea, and build it into a real venture, business venture. We teach them how to manage projects, both individual and group projects. And I would say that it has been very rewarding just to see what women what women can do with their lives, especially with very minimal support. But of course, LAFI comes in to provide seed fund, but at a later stage, just to really support or invest in the projects that are already ongoing. Mm-hmm. But it's been very rewarding just to see how women can become powerful. Women who are without a name, they become powerful people in their communities. Mm-hmm. Some of them sitting at boards of hospitali, and some of them actually really changing their communities in a positive way.
Akot kounoto ko kikotoret ichek kwanyik chesire 2,000 chemiche eng grupishek cheterter anan solidarity groups.
We are currently, by the end of 2025, we had supported treatment for over 2,000 women under Lesson Fistula Initiative. And out of the 2,000 women, we have 933 who are being supported through our integration program. And we are doing this through 43 solidarity groups. And our leading solidarity group is in Mount Elgon, which right now utajiri wao wote tunakadiria 5 million. And these are just 22 women coming together, really wanafuatilia ile mafunzo tumewapatia, doing projects and pooling the resources. And hiyo ni utajiri wa kikundi. You're not talking about utajiri wa individuals. Yeah, so and I've seen women do wonders in West Pokot. You go there, the terrain is horrible. Sometimes hatujui litokea wapi, but those women, the determination to rebuild their life cannot be challenged by anything. They come from very far. There's some wanatoka wanaanza safari kama leo, analia karibu ndio aingie kwa kikundi. And I told you that the leading group in West Pokot, their network is close to 3 million right now. Yes, and those are the things we see, the rewards we get from really the sacrifices we make as LAFI. Then there's also now what we do after these women have found themselves, their pockets are now doing well. They're able to support their families. Their children are able to go to school. They are able, they're no longer struggling, to meet their basic needs. Unapata kwamba they'll always want to give back to their communities. Mm-hmm. And lives with fistula, I think I would say that they face a lot of consequences. There's the economic, where I say they cannot engage in income-generating activities. There's the social aspect, whereby they're rejected. And most of these women actually send away from the matrimonial homes. Kabisa. Some are there. If they remain, then unapata kwamba the husband remarries, and you are forced to sleep on the floor. Things like that. There's also, there is the psychological part of it. Women who've lived with fistula for many years, they end up, having psychological issues. Abstinence, because after surgical treatment, you are supposed to abstain for about 6 months. And sometimes
kates komwa kole eng kasarta neisuldoi kwonyik konyoiset konyolu konyorchigei toretet kobun manung'otoikwak, kit netoreti ichek koistoegei kabwatutik.
Men play a critical role, because it's men who decide whether this woman is going will be going for anti-clinic checks or not. He's this man who is supposed to provide. He's this man who is supposed to provide leadership in his home about kupatia, najua kwamba my girl has an equal right pamoja na my son. So if these men are left out, unapata kwamba tutagonga mwamba. And therefore men remain at the center of what we are doing. They have a role. They have an important role. They need to lead their families with this understanding. And I realized, ideally men, they are not just supportive because they don't know what they're supposed to do. But the moment men learn their role, they actually take take up the matter and run with it. We have
eng komostanyi Martin Thiongo ne ine koteleljin komosta nebo neranik eng Levi ko oret agenge nebo kicher fistula konyolu konyorchigei kanetisiet tibik nebo kit neiriu miondab fistula ole nitok kosuldoe ichek mising eng sukulishek.
We handle the preventive arm of preventing the occurrence of obstetric fistula. Under this arm, we focus on creating awareness, and we do it through the school programs. So we have what we call the Youth Health Champions Clubs, which we have in schools, and we educate the students to understand basically it's the root causes of obstetric fistula. One of these root causes of obstetric fistula is a teen pregnancy or early pregnancies. So we encourage the students to defer pregnancy or early sexual involvement until their bodies are capable of handling pregnancy. We have out of trainings and capacity building to the students, and we also mentor their teachers to help them understand how to relate with the young people and how to easily communicate the most sensitive topics such as FGM, harmful cultural practices, menstrual hygiene and management, and also to help encourage or motivate the students to improve their self-esteem.
Kates komwa ine kole toreti tibik ak tuguk chemokyingei ichek eng somanet asikomuch kokanapta somanenywa.
We also encourage the students to go and teach other people, to teach their fellow students, so through the peer-to-peer model of learning, because we know that it is easy for them to communicate to their fellow peers in a language that only the peers can understand. And so we are working with around 32 schools in 4 counties, and up to this point we are happy to report that we have seen an impact. In some of the schools that we work with, we have seen improved grades. We have also witnessed reduction of teen pregnancies, and in some schools to 0, which is because of the capacity building we have done and the mentorship talks we have provided for the schools as a whole, and also through the champions that we have in those particular schools. And so we thought that it would be necessary to have a program or a project that is going to help us have those pads available to these particular students. And so through the project, we were able to get to produce over 4,000 pieces of reusable pads, and which was able to impact around 850 girls across the counties in which we work in. Now remember, when a girl has this pad which can last them for about 3 years, it allows them to be in school continuously for 3 whole years, which means that the likelihood of them succeeding in their lives is very high. Meaning we are dealing with the root causes of fistula. We are dealing with poverty, because once a girl has finished school and is able to go and continue with her education, it means that her own life improves and also the life of her family improves.
Kora kokaking'alal ak kanyoindetab kwonyik eng Kainokea Women and Fistula Hospital nekikotoret kwonyik chesire 6,000 eng kasarta nebo kenyisiek 13 chekikosirto, Dr. Nelly Okasiba.
In view of this day, we're speaking about obstetric fistulas. So in essence, that is communication and abnormal. When I say abnormal, it just means that it wasn't meant to be there. Yeah. So in this case, it refers to abnormal communication between the reproductive system and either the rectum or with the urinary system. So we have what we call RVFs, rectal vaginal fistulas, and we have what we call VVFs, vesical vaginal fistulas, which is pretty much just communication between the urinary bladder and the vagina. Those are the most common obstetric fistulas that we have. Most common cause is prolonged labor and obstructed labor. And the other common causes are also accidental, injuries during surgery. And in our setup, especially here at Gynocare, because of what we get to see, the other common cause of fistulas is cervical cancer and even radiotherapy as a result of treatment for cervical cancer.
Ikimiti kanyoikab kwonyik kole bo kamanut eng kwony age tugul nenyigis korutechi clinics tugul akochut ko eng kotab tililindo asikechir asenet neibu fistula.
There are exercises that someone can actually do just to prepare the perineum for labor. There's a place of physiotherapy, there's the place of counseling and education so that women are aware of what labor entails, what is expected of them. Because as I mentioned, one of the most common causes of obstetric fistulas, actually the most common causes are prolonged labor and obstructed labor. And most of those two things actually result from either delayed access to proper services, proper obstetric services, and at times it's in cases where maybe the woman cannot advocate for herself and she's being told to push and she has no capacity to actually do it. So we end up having prolonged labor. And that results in fistulas because it injures the tissues. And those things can be avoided just by as simple. When I say simple, it's not simple in that sense because technically a CS is a major surgery, but those could be avoided by a cesarean section. So there's the place of our women knowing their rights, understanding even the labor process and the modalities available, the options available to them for delivery. So during labor, it's just the place of self-advocacy and understanding. Knowing your rights as a woman, understanding that if my labor is not progressing well, then I have the right to actually ask my healthcare worker, are there other options available for me? And when you're talking about preventing fistulas, it's not just about the woman, it's also about us as healthcare workers. We need to be at the forefront, championing for our patients' rights, championing for better obstetric services for them.
Tinye kiy age tugul neboibochin kwonyik kosubkei ak nekikonyorchigei toretet, konyoiset koboto kosobet.
Pata shida ya fistula 2013 na nikatibiwa Kainuke kwa Dr. Mapea Kainuke Eldoret. Na nikapona. From nipona nikajoin hii group ya Ngerekyo group. Na nikaendelesha nikafanya people banking na tukakuwa na people banking sasa na kuchukua maloans.
Wakati tulianza kikundi mwaka 3 iliyopita, wamama walikuwa na fistula na walikuwa wanaogopa sana. Kwa sababu maneno ya fistula ilikuwa ni aibu, lakini vile walipata matibabu. Wamekuja pamoja sahi na wameungana na wengine wenye hawana hiyo ugonjwa na wameendelea vizuri sana. Kwa sababu wameshapona. Sasa wako naendelea vizuri na wako na furaha sana.
Nilikuwa na fistula, nilikaa nayo mwaka 5. Wakati nilikuwa na fistula nilitengwa sana. Sikuwa nakaribia watu. Niliathirika kwa muda mrefu sana. Tangu nisikie kuna penye wanasaidia watu. Wakati nilisikia nikaenda hospitali nikatibiwa.
Kikundi ya Levi imetusaidia sana kama wamama. Tumekuja pamoja na hao wamama wenye wako na fistula, tumeungana. Vile kikundi ya Levi walikuja wakatusupport kama fair. Sasa wamama wanakuja wakikutana, wakipata mafunzo. Kwa sasa tumeshaendelea.
Ndio tunasema asante kwa sababu watu ya Levi wametusaidia sisi mambo ya mbuzi, ya kuku na ya mbuzi. Tunasema asante. Hata transport naye tumetusaidia sisi sana.
Ibwatile nito kokonu mising kotesak kipkerermechet anan kabwatutik eng kwenutab biik. Kobate kakonyol kinet biik cho konai kole mitei walutik koboto konyoisetab miondo fistula. Kongetegei eng kanasetab Eldoret eng county nebo Uasin Gishu. Kainenyu ko Jerotich Korir.